Welcome to the Pacific Research Institute Next Round podcast. I'm Tim Anaya, PRI's Vice President of Marketing and Communications, and your podcast co-host. Well, this week we're going to talk about all things healthcare. As you know from the recent government shutdown, healthcare was at the forefront of the dispute between Republicans and Democrats. And at the heart of the issue was the extension of extended Obamacare subsidies that were put on during the COVID-19 pandemic. And Democrats and Republicans in Washington and President Trump and his administration are grappling with what to do on health care and how to resolve this dispute over the Obamacare subsidies. And we thought who better to come on and talk with us this week than our President, CEO, and Thomas W. Smith Fellow in Healthcare Policy, Sally Pipes. I always like to say that Sally has literally written the book on healthcare and many more. And if Republicans in Congress are looking for what to do legislatively on healthcare reform, well, they really just need to look at her book and turn it into legislative text, because she has the smart, proven, free market healthcare ideas that we need to bring healthcare costs under control and make it affordable for employers and ensure that everyone has access to affordable, quality healthcare options. So we talked with Sally about all of the issues that are going on in the healthcare debate in Washington these days, and we asked her to put her crystal ball to work, forecasting what she thinks will be done on healthcare in the coming weeks. So if you're interested in all things healthcare, this episode is for you. One quick announcement for you. Registration is now open for our 8th annual, I can't believe it's 8th annual, PRI California Ideas in Action Conference, which is our annual Sacramento Policy Conference. It's going to be held on Thursday, February 19th at the Sutter Club here in Sacramento. And of course, that's February 19th, 2026, with the new year shortly upon us. And we have some terrific speakers. We have one of California's great reformers, Matt Mann, the mayor of San Jose, is going to be our keynote speaker. And we have a really interesting guy and a recent PRI Next Round podcast guest, Chef Andrew Gruel, who's an entrepreneur, a chef, and now Huntington Beach City Council member. He's going to be our kickoff speaker in the morning. We're also going to talk about California's insurance crisis and have some really smart people talk about what we can do there, and have a panel of some of our state's top journalists come to share their insight on all the hot political news and our state's policy challenges we enter 2026. So it's a great event, and thanks to the generosity of our supporters, registration is complimentary. So go on right now to pacificresearch.org/events and register today to secure your spot. So now stay tuned. After the break, join us for Sally Pipes talking about the healthcare debate in Washington, D.C. Thanks for joining us. We'll get back to Next Round in just a moment, but first, are you getting PRI's regular email updates? If not, go to pacificresearch.org and click the sign up button at the top of the page to get the facts you need to fight back delivered every week to your inbox. Every week, PRI sends you what you need to know about what's going on in Washington, D.C. and Sacramento, and gives you the free market ideas needed to save our state and our nation. By going to pacificresearch.org and clicking the sign up button, you can sign up to have Policy Alert, our weekly roundup of all the best ideas from PRI scholars delivered to your inbox. Or you can sign up for event updates, so you're the first to know when PRI is coming to your community with great events. So sign up now at pacificresearch.org and click the sign up button at the top of the page to get PRI's content delivered to your inbox each week. Well, Sally, welcome back to Next Round Podcast. It's great to have you here again.
Thank you, Tim. I'm a one-trick pony. I can only talk about healthcare. So unless there's something interesting on healthcare, I'm not your best guest.
All of this debate that we've been having over the government shutdown and all of the budget issues in Washington must have been in some ways a bit of music to your ears, because it's all being really driven by the debate over healthcare. And it struck me that it might be good to start our discussion of the government shutdown and all of these issues with maybe how did we get here that subsidies, that are expiring for Obamacare. Well, why are they expiring in the first place? How did we get there in that point? And that all of these issues, right, of healthcare policy would be driving a debate over whether the government's going to stay open.
Right. Well, I think that's a good place to start. And just FYI, Tim, a lot of people in the media say, well, if they don't extend the subsidies, we won't have any subsidies. The issue is we're talking about not extending and ending the enhanced premium subsidies. So how did we get to this situation? Well, as you know, March 23rd, 2010, Obamacare was signed into law by President Obama. Included in that was, of course, healthcare.gov, the whole issue of subsidies for people, lower income people. The low income people would get subsidies, and then that would go up to 400% of the federal poverty level, at which point the free subsidies would end. So that was part of Obamacare. I fought very hard to have that not come into law because I saw it as a point to get to single payer health care in this country. So I think Obama, that's what was in the back of President Obama's mind with the Obamacare passage. Anyway, we had subsidies as part of the Affordable Care Act. But move forward to March 2021, COVID was in full force. And so it was in the interest of the government to enhance those premium subsidies so that because a lot of people had lost their jobs and so they needed help. So the American Rescue Plan of March 2021 enhanced premium subsidies for people who were in the cohort which were eligible for subsidies. They decided to extend them for a year. Then August 2022, the Inflation Reduction Act was signed into law by President Biden, and in that they extended the enhanced premium subsidies till the end of this year, December 31st, 2025. Move ahead to the 43-day federal government shutdown, the longest shutdown in the history of the federal government. And the shutdown was not about this program, that program, this finance bill, this financial situation. It was all based on the Democrat, and particularly the progressive Democrats, who wanted to either extend the enhanced subsidies by 1 year, 2 years. Hakeem Jeffries wanted to extend them by 3 years. And many of the progressives, Bernie Sanders, AOC, Pramila Jayapal, they wanted those enhanced subsidies to be made permanent. And that's how we got to the shutdown. And in the end, the shutdown ended without having the enhanced premium subsidies be part of that reconciliation bill.
I guess it's, Rahm Emanuel's line at work, right? Don't let a crisis go to waste, right? But so now we're here at this point where we passed the continuing resolution. So there and kind of agreed, okay, now we're in a point of, well, let's talk about it. Maybe there'll be some negotiating. Senators have different ideas. The president have a different idea. Maybe go through and explain, because I think when people hear about it, you really scratch your head why we're doing this. What are those enhanced subsidies? Who's eligible for them? And kind of make the case. A lot of Republicans tend to run away and hide when we debate these healthcare issues. Why should we let them expire? Make the case for us.
Right. As I like to say, and you just made the point, Tim, understanding healthcare is similar to unraveling an onion. Many layers and many tearful moments. And members of the Republican Party and the Democratic Party shudder when they think they have to talk about healthcare. So, as we just mentioned, the enhanced subsidies were not part of the continuing resolution. Of course, the financial part of this ends on January 30th, 2026. So we'll be back to the drawing board once again. But in the meantime, in order to get the deal, the Democrats and Republicans agreed that they would have a meeting in early December to separately discuss the enhanced subsidies issue. The Senate went on recess for Thanksgiving on November 20th. And so it'll probably be sometime between December 2nd and December 15th when the two parties will meet to try to come up with a deal on the enhanced subsidies. They have, as I said earlier, till December 31st to solve this issue. I, of course, am completely against extending the subsidies. I would like to see them end extended at the end of this year. And I think based on the hearing of the Senate Finance Committee on November 19th, it's looking quite good that the Republicans seem to be buying into, yes, we have to end these enhanced premium subsidies. So what are the enhanced premium subsidies? Who became eligible and what are they costing? So if they are extended for any of the periods we've just talked about, the Congressional Budget Office has said the cost will be $350 billion over 10 years, a huge cost. But what we found was that by extending the enhanced subsidies, 1/3 of the people who are on Obamacare and getting their coverage through the exchanges, 1/3 of those people now earn over 400% of the federal poverty level. And that used to be the end point. So you have people, a family of 4, earning $129,000 a year, and they are getting subsidies to buy their coverage on the exchange. We also know that under the IRA, it was that no one could pay more than 8.5% of their income for Obamacare coverage. So what's happened is, under the enhanced subsidies, we have people earning $500,000 a year who are getting subsidies of $8,000 a year. So, and the important point is that there is no eligibility system to make sure, are these people, are they truly eligible? And so this is absolutely ridiculous that people earning $500,000 a year are eligible for a subsidy of $8,000 a year. So these subsidies were originally intended to help those people who, were out of work or didn't make enough money to get coverage, couldn't get individual coverage. So this is completely out of control, the amount of money that we are spending on these enhanced subsidies. And as I just mentioned, the CBO says if we extend them and make them permanent, $350 billion over 10 years. Of the people of the 24 million Americans who are on the Obamacare exchanges, 12 million of them filed no claims in 2024. 84% of people with private coverage, Anthem, whatever, United, 84% of those people filed at least one claim a year. So why is it that 12 million people that were on the exchanges did not file a claim? Well, according to Brian Blaze from Paragon and from my own work, it seems that the insurers, the brokers, and the agents they've been enrolling people on the exchanges without someone like yourself, Tim, knowing that you have exchange coverage, so therefore you would never file a claim. And so this is completely fraudulent because the brokers and agents are getting paid, but you don't know that you have coverage. So this is an important aspect of the whole situation. So here we are, President Trump, we're not quite sure, I wasn't quite sure where he was going to come down on the enhanced subsidies, but as you know, on Tuesday, November 18th, he came out and in talking about the expanded subsidies said, the only health care I will support or approve is sending the money directly back to the people, with nothing going to the big, fat, rich insurance companies who have made trillions of dollars and ripped off America long enough. So he made this statement originally on Truth Social, and he reiterated it again on the 18th of November. So that is something that we have been pushing, as you know, Tim, for years, empowering patients, not the government. And so I'm excited about this. We'll have to see where it goes. Senator Bill Cassidy, who is chairman of the Senate Health Committee, Health, Education, Labor, and Pensions, he came up with an idea shortly before Trump came out and said he thought people should be able to receive the subsidy from the government themselves and then use their flexible savings account to purchase coverage. But I think this would be even better if people could get their subsidy themselves and then go out into the market and buy a plan. And we don't want people just to be stuck with buying an exchange plan. We want to have options, and we can talk about some of the other ideas that would work to reduce the cost of healthcare in this country and to improve the quality of care that people get. So many things I don't like about President Trump on his healthcare agenda, but I'm pleased that he did come out and say he's supporting empowering patients rather than insurance companies.
We'll get back to our great guest in just a moment. But first, are you following PRI on Facebook? By following PRI at facebook.com/Pacific Research Institute, that's all one word, you'll be the first to read free market ideas from PRI's terrific team of scholars on all the hot issues like education freedom, single-payer healthcare, crime, homelessness, green mandates like the ban on natural gas appliances, and more. Plus, when you follow PRI at facebook.com/Pacific Research Institute, you'll be the first to know when tickets go on sale for PRI's must-attend luncheons, dinners, and galas across the state. And you'll be first in line to secure your spot to hear great speakers like Michael Schellenberger, Gordon Chang, Steve Hilton, and many more. So go to facebook.com/Pacific Research Institute and follow PRI today so you'll be the first to know. So, following up on that, it's good to see, for so long it seemed, and I know it frustrated you and it would frustrate me when you'd hear about it. It's not like they don't know what they should be doing. I would always say when I would give talks on these issues in healthcare would come up, Sally's literally written the book on it. And yet, they were either afraid or wanted to stick their head in the sands or whatever the reason was to not engage on these issues when we have great ideas that would improve healthcare for all Americans, be fiscally responsible, all the things we want it to be. So, first, let's follow up on that, these ideas that President Trump and some of the Republicans in Congress would talk about. In practice, knowing all the deadlines we have and all that, how do you think that would work in practice? What kind of, maybe would there need to be a transition, from how it is now to this system? How do you see it going forward in how would the legislation work? How would the transition to that type of a system work?
Well, as you know, Tim, these transitions are not easy. But if you think back to Obamacare 2010 when it was passed, the exchanges opened in late 2013 for a start date of 2014. Remember healthcare.gov, how difficult that was. So I'm not sure about we don't know many of the details yet. And a lot of people in policy, people such as myself, say the devil's always in the details and we're waiting to see. So I think it's a bit early, but I am glad that the conversation has moved towards giving those subsidies back to patients. And not in addition to doing that, we need to make some other changes. Medicare, for example, which, covers about 65 million Americans, are elderly, people over 65. What we need to do is voucherize people on Medicare so that they can take their health savings account and use it to buy a plan that suits their needs. We have under Obamacare, as you know, the evil EHBs, the essential health benefit. There are 10 essential health benefits. Now, Tim, you may want a plan that covers alcohol rehabilitation because you have to deal with people like me every day. I may want a plan that covers in vitro fertilization because at my old age, I want to be like the women in India that have children at age 80. But not everybody. You should be able to buy a plan that suits your needs and those of your family. And if you can do that, you can then get a plan that it will be much cheaper than including the cost because insurers have to cover all of these mandates and regulations. So if we voucherize Medicare so that people could use their HSA to get coverage, that is a great idea. But there are other great ideas too. Remember, President Trump made possible the ICRAs, the individual coverage health reimbursement accounts, where employers give the money that they would normally set up for their employer-based plan to the employee and let the employee buy the type of plan that fits their needs. So that is another important thing that we need to do. Also, remember short-term limited duration plans. President Trump made those possible. You could get a short-term limited duration plan for 364 days, renew it for 3 years. And this was a great idea for young people. Most young people are A, young, and B, healthy. And second, there are people who have lost their job, they're between jobs. This short-term limited duration plan was a terrific idea and worked well. In comes President Biden, and he says, well, I don't like this. I think short-term limited duration plans should be short-term 3 months with a 1-month renewal. I'm hoping that President Trump will return to the short-term limited duration plan of 1 year renewable for 3 years. This will help. It'll help reduce the cost and it will cover a lot of people. Then there's association health plans. That was also part of Trump's first plan where small groups like think tanks could band together or religious groups and have a larger risk pool, which would then allow them to get insurance at lower lower price. So we've got voucherizing Medicare. We've got giving the subsidies back to patients. We have short-term limited duration plans, letting them flourish again, association health plans, and getting rid of mandates and regulations, including getting rid of the 10 essential health benefit plans. Those are all things that we can do to put doctors and patients in charge of their health care and move us away from Bernie Sanders, I call the Pied Piper of single payer, getting his wish. Because as he gets up on the stump, invariably, he's been talking about single payer healthcare probably since he was 20 years old. I mean, he always uses Canada, my homeland, as an example. The single payer healthcare system in Canada is a disaster. The average wait today from seeing a primary care doctor to getting treatment by a specialist is 30 weeks. That's over half the year, well over half the year, and it's not free. Remember Bernie Sanders, single payer healthcare, it's free to the consumer, to the patient. No, it's not. The average Canadian pays in hidden taxes $19,000 a year for a healthcare plan where they're on a waiting list, there's a doctor shortage, and they don't have access to the latest treatments and technologies that we have come to expect in this country. So these are some of the things that we need to do, and I'll be pushing on this, and let's hope that President Trump, buys into the fact. And the other issue is that, Obamacare is a disaster. The cost of the premium back in 2013, prior to healthcare.gov coming into effect in Obamacare, the average premium for an individual was $244 a month. Today, that same average premium is $590 a month, and it's ridiculously expensive. And we only have 24 million Americans on the exchange plan out of our population of 330 million people. It's a very costly experiment that is not working for the American people, and we need to get back to market-based principles in healthcare. Healthcare is like any other good or service, and we need it to work.
I always say, just take Sally's book and make it a bill. That's what we should really be doing.
Tim, it doesn't matter how many times I write op-eds, I do media things, how many books I write. I feel like I'm still, putting my finger in the dike and banging my head against the wall because, as we said earlier, it's complicated, but it's not complicated if you want to put people in charge. And one of the exciting things, too, is direct primary care. This was also included in the OBBBA, the One Big Beautiful Bill Act that Trump signed on September 4th. It allows people with health savings accounts, which allows people to put their money away tax-free, carry it forward each year. It allows them to then use their HSA to purchase a direct primary care subscription with a patient. That then means you have a direct primary care doctor. He doesn't deal with insurance companies. You don't have to find out that you've been denied something. You didn't get a prior approval, didn't work. You work directly with your doctor. You get ready and easy access to your doctor. And it's a great way to put patients in charge. So I'm excited that Trump, that was included in the OBBBA, and I think it's going to be a great plan going forward as we put patients in charge of our health care.
Let's talk about, you brought up Bernie Sanders and all the Hakeem Jeffries and all the Democrats who've been messaging on this issue. And, I'll give it to them. They're good when they get on their little TV hits and do their speeches. Everything they're saying is wrong, but they do say it well. And it's one of the things where Republicans kind of run and hide when, you see a Bernie Sanders or a Jeffries pushing these things. And one of the things that they've really been good harping on, right, is all these millions of people are going to see their premiums go way up, and, we've got to do it for them. What's your response to a lot of these things that you've been seeing Democrats saying on the stump and in Congress about these subsidies? Would the sky really fall? When I hear you say these are up to $500,000 a year, that's rich everywhere but California.
Yeah.
How, if you were advising Republicans rhetorically in the debate, what would you tell them to say to push back when you hear Democrats engaging in all this sophistry?
Well, I would talk about as the things that we've just talked about, how we can actually reduce the cost of healthcare and get out of Obamacare, one would hope, and improve the quality of healthcare that people are receiving. I mean, I think Hakeem Jeffries, Bernie Sanders, they all want single payer healthcare, and so they see if they don't get the enhanced premium subsidies extended, it's going to be more difficult for them. But when people in Congress or in state state offices go out and tell the people who is actually getting these subsidies, the income levels of people getting these subsidies, and the fact that insurance under the ACA has become very expensive, they are going to understand that people know in their own minds what they're paying for various things, and healthcare is expensive. If we reduce mandates, regulations, reduce red tape, give people other options which will suit families' needs. The Republicans can say this, and when they say, and maybe the man on the street doesn't understand enhancing expanding the subsidies and making them permanent, that it costs $350 billion over 10 years. Maybe he doesn't understand that relative to his income, but they know it's a big number. They know that the subsidies, the whole idea of the subsidies was to help those people at 138% of the federal poverty level up to below that and up to 400%, not allowing people earning $500,000 a year to get them, or even a family of four with earning $129,000 a year. Why should they be getting a premium subsidy? Some people are even retiring early in order to get these subsidies. That means that the younger generation, not my generation or yours, Tim, but the young people are going to be paying huge tax increases to support this. So we really need the Republicans to stand firm, not be wimps. Remember Margaret Thatcher? Mugwumps. They're mug on one side of the fence and they're wump on the other. It's time to take hold and be tough on this. It's a terrible program, and we need eligibility rules so that we don't have 12.5 million people that have been signed up for exchange coverage and they don't even know they have it. There's so much that can be done to get rid of fraud and abuse and move to a free market-based healthcare system that, like in so many other aspects of our life, we can make choices based on our own families, our own income, and what we want for ourselves.
Before we go to our closing question, that 12.5 million figure to me is shocking. That amount of money that people may not even know they're on these plans, or they're useless plans. What can we do on that? Is there something in this debate that Congress can do to require either we cancel these plans or make people, and what can we do to get that number down? Because gosh, if you're not using it, why are we paying for it?
Well, I mean, the sad thing is that people that need to go to the doctor, they don't even know that they may postpone going to the doctor or not go at all because they think they don't have any coverage. So we need to, I think President Trump was right in saying we don't want anything going to these big, fat, rich insurance companies and the brokers who are selling these plans and making a profit off when they get their return on selling a plan and people not knowing about it, that therefore they don't get good health coverage, or they, as I say, they may delay going to the doctor because they don't think they have coverage.
Because it sounds like a great scandal to me. It reminds me of, you remember the Wells Fargo scandal from several years back, where the agents got a bonus for signing people up for new savings accounts, I believe it was. And all of these
Yes.
millions of people got savings accounts and didn't even realize it.
Right, exactly. Well, it's the same kind of thing, but we need, eligibility rules and 6-month eligibility to make sure that you are still requirements to make sure that you're still eligible are important things. But we need to get back to, who are these subsidies for? And when often you hear people in the media, and even I heard Hakeem Jeffries saying the subsidies are going to end. No, the subsidies are not going to end. It's these enhanced premium subsidies that came into being during COVID when we had a crisis. That crisis is completely over, and we need to, get back on our feet and end this at the end of this year.
So as we close, let's do a little bit of prognosticating. So we've got the end of the year deadline. We've got the end of January deadline. Do you think in this limited amount of time they can really get the job done and agree amongst one another and have a bill that makes sense? What do you see is the most realistic path forward here?
Well, I am optimistic today. I like to be an optimist. Milton Friedman used to tell me I was a Pollyanna, but I do feel that Senate Finance hearing on November 19th really, explained to members in the Senate what is going on here, and I think they're getting it. So we have to hope that progressive Democrats don't destroy this and change their mind, because as I say, people are out there saying the subsidies are ending. No, they're not, and we want to get control of our deficit situation, and we want to have healthcare, affordable, accessible, quality healthcare for all Americans. And by subsidizing people that don't need this subsidy, we're taking away the opportunity for people who really need healthcare and we want them to get good health care, to get access.
Well, my advice to members of Congress, if you're wondering what you should do, I've got a few books by Sally Pipes I could suggest that you read, and it'll give you the path forward of everything that you need to do. Sally, it was great that you could come back and we have this chat and talk about all things healthcare. Once again, it always seems to always come back to healthcare.
It does, because we all want to live longer and healthier lives because life is so much fun.
That's right. Sally, thanks again for joining us. It was great to have you.
Thank you, Tim. Take care.
If you like this episode, please tell your friends and subscribe to PRI's podcast at iTunes, Google Play, Stitcher, TuneIn, iHeartRadio, and Spotify. And when you're on these platforms, don't forget to give us a big 5 stars. If you don't subscribe to any of these, you can still listen on PRI's YouTube page, youtube.com/Pacific Research 1. That's the number 1. Thanks for listening. I'm Rowena Itchon. Hope you'll come back again for next round with PRI.